And now let's turn our attention to one of the prominent leaders in healthcare. Please join me in welcoming Shri D. Randeep D, IAS Commissioner, Health and Family Welfare Services, Government of Karnataka. He will be sharing insights into the significant role of Karnataka government in advancing digital health. Please welcome Shri Randeep Dev to the stage.
Morning to one and all. I would have loved to speak longer and stay as part of this event, but I have on an extremely tight schedule. I have to be back at Vidhan Soda around 11:15 for another meeting. But thank you, Mr. Vishnu, for having me here as part of the Digital Health News initiative, and congratulations on the new website. Truly honored to be a part of this Think Forum, this panel here. The invite today to a government administrator means a lot, and it just shows the journey that probably government has traversed in the field of digitalization, and very specifically health digitalization. I think we have taken very few small baby steps presently. Something which has been there in the private sector for a fairly long time. Things like digitalization of our file systems, the e-office system. We have a digital attendance system today. We have a lot of digital data-driven dashboards and reports which are available for our reviews. So these are certain initiatives which have been there over the past 5 to 10 years. Quite recently, of course, being in the health sector, I've seen how the health management information system has really helped our department drive forward its initiatives, and also help plan our resources better, plan our strategies better. Telemedicine, of course, has come a long way. We have been tying up with various organizations, private sector partners, organizations like NIMHANS and other esteemed organizations, where we are able to drive our last mile health delivery systems through what is popularly known as the hub-spoke model. Government, as you know, has its own limitations in terms of having the adequate number of specialists or technology right at the last mile, be it the primary health centers or the community health centers. So the new model of a hub-spoke initiative kind of helps us ensure that mental health services are provided at the last mile, neurology services, healthcare services are provided. Even the ICU bed monitoring can today happen remotely through what is known as the tele-ICU model. We have a cardiac care support hub and spoke model also, where patients who have undergone a heart attack can immediately be kind of brought back to normalcy, at least near normalcy, within the golden hour, through purely a hub-spoke model. So these are all exciting initiatives that the state has driven. Of course, the Ayushman Bharat Digital Mission, which is driven by Government of India and very ably kind of supported by the state government in Karnataka, has helped us create a digital ecosystem across all government hospitals presently. So we have concepts of the health professional ID, where doctors register. We have the health facility registry, where health institutions register. And then, of course, what is now come to replace or complement Aadhaar, what we call as the ABA, the Ayushman Bharat Health Account ID, which becomes really a game changer in terms of creating a digital footprint for patients, for beneficiaries of health schemes. And this helps us kind of cut out any kind of redundancy in the system, any kind of duplicate beneficiaries. And we have a tremendous opportunity ahead of us because of this. Probably sometime very soon, next week, we will have the launch of the Microsites initiative, where we will onboard a lot more private healthcare establishments onto the ABDM digital platform. The only advantage of this is there is a lot of exchange of digital information across healthcare systems. A patient finds it that much easier to move from one healthcare establishment to another, And since there is going to be a digital record, digital healthcare record of the patient, he or she really does not need to carry the prescription slips, the diagnostic reports virtually. So you have what is known as a health DigiLocker today, where almost everything is available to a patient by virtue of a personal healthcare record. So these are certain initiatives that the state has been taking and will be pushing in the coming days. Of course, these are not without challenges. The challenges are multifold. Some of them which I could list out last evening was availability of low-cost plug-and-play initiatives which can fit into our larger public health systems, which already has multiple applications. Now, how does one fit it in so that there is a seamless flow of information and we are able to extract data at all levels? We are also looking at how to push digitalization amongst doctors and nurses, knowing very well the load, the patient load that is there in the government sector. Data storage again forms a huge challenge with the Data Protection Act in place. Privacy concerns in digital systems become a huge issue. So that is something that we need to look at. And the most exciting aspect of all, artificial intelligence, which is taken over the healthcare sector in a really big way. How best can that be used to build predictive models? Because at the end of the day, healthcare is not just about the curative aspect, healthcare is also about the preventive aspect. So as many detective models that we can put in place, we recently have tied up with a prominent company who's kind of provided us a system wherein we could even detect lung disorders, including lung cancers, purely by scanning regular x-rays which a patient would take at a hospital. So innovative technologies like these, our doors are open. I'm sure this is a good forum for me to reach out to all of you to come and meet us and let us know what exciting things are happening and how this can be adopted very well in the government system. So sorry for addressing you very briefly, but these are few of my thoughts which I thought I should make use of in a forum like this to address all of you. I thank Vishnu and team again for having me here. And post this session too, if you need to reach out, my contact is available. Please do reach out and let's build a stronger and healthier Karnataka and India together. Thank you.
Sir, please, I would request you to stay on the stage, please. As I would like to invite Mr. Vishnu Saxena and Mr. Girish Kulkarni, Chairperson, Chime India Board. Please welcome to the stage to honor Sri Randeep D for his invaluable contributions. Thank you everyone for your presence on the stage, and special thanks to Sri Randeep Dev for shedding lights on the remarkable strides taken by the Karnataka government in advancing healthcare, from pioneering neurology services to fostering mental health care and cardiac care support models. Your insights into the government's initiative and the digital ecosystem exemplified by Aadhaar have truly been enlightening.